Morning class, my name's Paul Finish and I'm doing my practice speech on medical tourism. Is medical tourism a viable alternative to rising healthcare costs in the United States? At the National Conference of State Legislators, the Kaiser Family Foundation stated that back in the 1970s, the United States looked a lot more like other countries when it came to healthcare spending. In 1980, we spent $1,110 per person on healthcare, which worked out to be 9.2% of gross domestic product. But in the 1980s, healthcare costs in the United States began to grow much faster than in other countries, rising to $84.02 a person in 2010. That amounts to a total of $2.54 trillion spent on healthcare, or 17.9% of our total economy. $8,402 per person, 2.5 trillion, those are incredible figures. It is therefore hardly surprising that many individuals are looking elsewhere to offset these costs. I have an interesting perspective on this one, actually. My wife is from the United Kingdom, where healthcare is free. Our family lived in England for 2 years, and it was certainly fantastic being able to go to the doctors and not worry about the bill and what was going to follow. It was also wonderful that my wife managed to have both of our children there, and yes, you guessed it, without receiving one single bill. When we first came back to America, it was very tough, especially for my wife, to deal with the reality of keeping our children healthy without access to medical insurance and on a very tight budget. It certainly does make one think about the possible alternatives to paying the high prices that are expected here for medical treatment. And it does make medical tourism seem like a viable alternative to health costs, or the rising of health costs in the U.S. In fact, the organization Patients Beyond Borders state that there are 11 million cross-border patients worldwide spending an average of $3,500 to $5,000 per visit, including all medically related costs, cross-border and local transport, inpatient stays, and accommodations. They go on to say that we estimate some 1,200,000 Americans will travel outside the U.S. for medical care this year in 2014. Patients Beyond Borders call such medical travelers, which they define as anyone who travels across international borders for the purpose of receiving proper medical care. Their website offers a host of statistics on this subject, including the percentage of savings possible to those who are treated in countries such as Brazil, Costa Rica, India, Mexico, Thailand, and Turkey. According to Patients Beyond Borders, the same savings can sometimes be as much as 90%. Surprisingly, though, there are reasons other than the cost that encourage individuals to become medical tourists. Joseph Woodman, writing in the 2008 for USA Today, suggests that a desire for better health care is also a reason, as is seeking of treatments that are considered specialty or treatments excluded from many insurance plans. He therefore suggests that patients travel to combat wait times, or even simply to receive more friendly care that is not rushed. I would incur many of these reasons, and also many of my own, add many of my own to the list, which makes medical tourism a definite lure for me. The opportunity to visit another country, perhaps. To my mind, why pay to go to Europe and pay for medical treatment if I can get a package deal on both? Medical tourism can be combined with regular tourism. Of course, ensuring that the treatment is best available and the medical center accredited should be the first concern for those people seeking international treatment. But it is totally wrong to assume that something is inferior simply because it is not in America. Many countries around the world have impressive medical care facilities, great doctors, and excellent overall life as a result. And if medical tourism is an option in my future, I think I'll go visit one of them. Thanks everybody for watching. Talk to you later.